Oh, well, hello everybody, and welcome to the next in this series of webinars from the global platform. And this week we will be looking generally at what role gerontology and gerontologists are already playing and perhaps could do more to address the coronavirus pandemic, specifically in low and middle income countries. Next, please. And this is being organised jointly with the special interest group of the British Society of Gerontology on ageing in Africa, Asia and Latin America. And one of the organisers of that group, Penny Virasanso, is going to share a few words a little later in the webinar, perhaps commenting on any specific role that that group might be able to play. I guess not everybody who's listening in today would necessarily describe themselves as a card-carrying gerontologist. I guess most people understand gerontologists as people who are academic researchers whose research focuses to some extent on older people. But I thought perhaps without going into tremendous detail, it would be useful to provide a more precise description of gerontology for the purposes of today's webinar. Next, please, Lucas. This comes from the website of the American Society of Gerontology, and I think it sets out some useful parameters. Firstly, it shows that the focus of gerontology is both on the individual, but also on society as a whole, and generally speaking is an applied area of research, so it's trying to apply knowledge to policies and programs. Also, just looking at the language there, you can see that gerontology isn't just interested in older people, however you define them, but it's interested in wider processes of aging, both at the level of a population and of individuals. Next, please. They emphasize that gerontology isn't just multidisciplinary, but really it spans the entire range of academic endeavor, from clinical science to social science to the humanities. And as a part of that, it's stated that geriatrics isn't really a separate discipline, but should be understood as part of this whole umbrella of different disciplines within gerontology. Now, maybe some associations of geriatricians would argue that they are in fact perhaps a rather larger tail that wags the gerontological dog, but I think it is actually very useful to see geriatricians as part of this multidisciplinary field of research. So if that's what I understand gerontology to be, what role have gerontologists been able to play in the pandemic? And of course, we'll hear Tom's thoughts perhaps about what's gone on in the UK later on today. But I thought I would just focus very briefly on a couple of things. The first one, and probably the most obvious starting point, is to look at the extent to which gerontologists and geriatricians, if you see those as separate, have been able to participate in the most influential expert committees influencing government decision-making. And this slide here refers to the most influential government scientific committee in the UK SAGE, and you can see these are the descriptions that the members give of themselves. Nobody mentions geriatrics or gerontology. Now, it's possible that some of these people may be statisticians or epidemiologists who are also gerontologists, but if you look closely at their personal profiles, I don't think anybody really falls into that category. There is a member who's specifically interested in low and middle income countries, and that's Charlotte Watts. But the main focus of her research over the years has been violence against women and hasn't focused specifically on women at older ages. Next, please. There is another very influential scientific committee in the UK, which was set up to take a more critical approach to government policy, and essentially it consists of academics, senior academics, and was self-appointed by the great and the good of academia, so it's separate from government. But again, there are no experts, as far as I can tell, in either geriatrics or gerontology. Looking at low middle income countries and global health, there are two members who have particular interests there. One is Anthony Costello, who was a director of the department in WHO and is a pediatrician. And the other one is Martin McKee, who I work with on a number of different things. He does have some interests in older people, but he would never deign to describe himself as either a gerontologist or a geriatrician. So this doesn't look very promising in terms of the profile of gerontology in the UK. I'm not saying that this is representative of the limited involvement of gerontologists in the UK, or whether at all it represents what's going on in other parts of the world, including low and middle income countries. Next, please. In past webinars, what I would quickly do is, if we were focusing on 2 or 3 countries in our talks, I would quickly give an update on the status of the pandemic in those particular countries, because often it was quite diverse, based on the available data. And at first, the data were very limited, very scratchy, but there was a hope that over time, the quality of the data and the coverage of the data would improve, so that we'd be able to provide more robust evidence about what was going on in terms of older people. This hasn't happened. It hasn't happened at all. Lucas, can you click on the hyperlink for me, please? This as an example, this hyperlink of a fantastic initiative, which has succeeded in generating data on sex and COVID around the world, and has really, it's taking a while to download, unfortunately. So actually, Lucas, don't worry, just go back to the, oh, here we are. It's great. Lucas, if you can just quickly sort of explore it on screen, if you see what I mean. This is really, really good. You can get data on individual countries. This is a very sophisticated platform. It doesn't say the quality of all the data they have is necessarily good. They have to work with what's available. There was absolutely nothing in a million years anywhere near this, which is separating data between different age groups. Lucas, can you go back to the main presentation, please? The global platform's been trying to look at what is available, and there is very little available. And from what we can tell, in terms of official reported deaths on from coronavirus in low and middle income countries, the proportion aged 60 and over ranges, from what we've been told, from about half to about 3/4 of all deaths. But frankly, I think that's a very large underestimate of the proportion of deaths in later life, because frankly, the quality of data coming out of most of these countries is so poor. I think it does more harm than good. And here's an example of that. Lucas, who's managing this session, did some analysis, which was published on our website, of data from Peru over a 4-month period. And officially, there were 5,900 deaths among people aged over 60. But when he did some quite sophisticated analysis calculating excess deaths, he was able to show that there were in fact 37,000 deaths among people aged over 60. So that's an enormous gap. And taking excess mortality as a whole in Peru over that period, 78% was occurring among older people, which gives you a sense of the heavy burden that they're bearing in the pandemic. So I think this lack of data both reflects the marginal influence that people interested in older people have been able to have over monitoring the pandemic nationally and globally, and also, of course, limits our influence because we don't have evidence which we can then deploy to present our case. So 2 rather negative scenarios in terms of the apparent influence, certainly at the global level, of gerontology in the context of this pandemic, although I suspect other speakers will be able to put forward some more successful examples. Next slide, please. Okay, well, that's all from me. I'm going to very briefly, before I hand over to Thomas, hand over to Lucas, who will explain to participants in the webinar how they can ask questions.
Hello, thanks, Peter. Welcome to all participants. We have three different ways you can ask questions and interact with us. You can use the Q&A button. You can make questions and we can answer them either written or orally at the end of the session. The chat, And we are live streaming on YouTube. So if you make comments there, I'm gonna keep an eye on that. I think that.
Thanks. Next, please. And now I'd like to hand over to this week's guest chair. So each of these webinars has its own chair, and it's fantastic that we've been able to get Thomas Scharf to be the chair for this webinar. He's president of the British Society of Gerontology. He's a professor at Newcastle University. His research has tended to focus on high-income countries, but I think he's one of those gerontologists who's always been able to see the bigger picture and has taken an interest in issues not just in high-income countries, but around the world. So it's an absolute pleasure to be able to hand over the reins to Thomas, who will manage the rest of the webinar. Thank you, Thomas.
Well, thank you so much, Peter and Lucas, for arranging this really fascinating webinar on what I think is an absolutely crucially important topic that has become even more important within the context of COVID, which is about aging and in low and middle income countries. I'm as president of British Society of Gerontology, of course, I'm really pleased that this session is being organised in collaboration with our special interest group on aging in Africa, Asia and Latin America. And we'll be joined later on by Penny Virasanso, who will say a few words about what that special interest group is doing and how people might be able to engage in that. So what I'm going to do is I'll just say a few words ahead of introducing each of the speakers. Then we'll take questions after the two presentations and engage in a broader discussion which looks at the actual role of gerontology within the context of COVID in low and middle income countries, perhaps learning from what's been happening in high income countries, but also thinking maybe more creatively about how we can support gerontology to become even more engaged in the key questions which are going to affect all of our societies for years to come based on the COVID experience. So I'm going to start by introducing Jay Sokolowski. Jay is Professor of Anthropology in the Department of Sociology, Culture and Language at the University of South Florida. Jay's work over many years has really, I'd say, made a substantial contribution in terms of how the field of cross-cultural gerontology has evolved. That his edited book, Growing Old in Different Societies, Cross-Cultural Perspectives, published in 1983, brought together an amazing array of scholars who brought the really important insights from anthropology into a more mainstream gerontological agenda. And that work has continued as over time with Jay's most recent book, The Cultural Context of Aging, which was published earlier this year, now in its 4th edition. And, you know, that really is a fascinating collection in terms of the range of contributions from both familiar and unfamiliar scholars, I would say, within the field of gerontology, but spanning into anthropology, sociology, and related disciplines. Reflecting his interest in Mexico in particular, Jay's paper today is on the topic of the cultural context of public health response for elders in the time of COVID-19 in Mexico. And with that, I'll pass straight over to you, Jay. Very welcome.
Thank you very much. That's a wonderful introduction. I see the first slide is up on the screen. I would preface this by saying, having been involved as an anthropologist in the study of late life, one of my mantras, which I have tried to embed, especially to younger scholars, has been that research and policy has to be set not in old age, but in the life course and in connecting uh, later lives to the whole life course. Um, and that is one way you really connect the wonderful research and data that gerontologists are doing to the work of geriatricians, public health people, and even doctors who are sometimes reluctant to engage with sociology or anthropology. Um, on the screen, you can see some images from a rural area, a mere 60 miles from Mexico City, one of the bigger cities in the world. And I've been engaged with people there since 1972 when I did my PhD work on globalization in indigenous communities. And while I was last there towards the end of 2018 for the Day of the Dead celebration for a compadre who unfortunately died at age 52 from diabetes, and that will come into the discussion here of public health issues and cultural context. One of the things that some people on the panel may know is that in countries like Mexico, not only has obesity emerged as a huge problem, but connected diseases such as diabetes have spiked dramatically. And unfortunately, I've been a witness to this even in small rural towns, indigenous communities, like the community of Amanalco. And one of the benefits of the current social media evolution and spread around the world is being able to have almost continuous contact. And these three images reflect that. And especially since I'm involved with publishing in Spanish a multimedia book I did on the community and the region a few years ago. People are feeding me almost daily things happening in the community. So in the upper left, as people came to realize the impact of the spread of coronavirus, and as a handful of people died from it in the community took things in their own hands. And what you see there is a roadblock in the entrance to the community, checking that people only from the region are coming into the community. And that happened in late April. A few weeks after that, someone sent me the photo on the upper right in the church. There's a beautiful 1609 Catholic church in the plaza and center part of the community. And all of a sudden I was shocked to see this even before such precautions with masks and face screens were set up. Anything happening in the church had to be at social distance and with the helpers to the priest wearing a screen and mask. And I'll get to the public health logistics in Mexico in a moment, but despite the scene in the upper right, one of the troubling things, and I got this yesterday, part of a video. This is a video screenshot from a wedding that happened a few weeks ago in the community. And one of my friends in the community, who's a musician about age 60, sent this and reports that virtually no one he knows when they go to such events as a wedding. This one had probably 300-400 people, even though it was outside. You see the big tent enclosing the place because it still can rain this time of the year. So he is particularly concerned about an uptick in coronavirus cases. Now, in thinking about this discussion, I found it profoundly ironic that when Mexico became aware of coronavirus, it did so through the country's first cases, who were wealthy Mexicans returning from a ski trip in Vail, Colorado. And this was touted in the media and by politicians who said that, well, we really don't have to worry about this because this virus is a disease of the rich. And unfortunately, from a public health perspective, this helps set the stage for Mexico continuing to have a very, very high infection rate, although we cannot have any glimmer of an idea of how bad it is, although the most recent estimates for Mexico City, where the highest rates of infection, the highest number of deaths are, it is estimated that fully 1/3 of the Mexico City population has been infected. I say it's hard to know the infection rates throughout the country because even looking at Latin America and North America, Mexico has the lowest testing rate of any country, far lower than Peru or Brazil or Argentina. I also found it really unusual, and I was shocked about this, that in thinking about the response of countries like Mexico, it apparently was unfortunately paralleling what has happened in the US, with the head of the Mexican government minimizing the threat of COVID-19 and basically leaving big city mayors and state governors left to balance the lives of people in the political domain, or risking their political lives by countervailing the political statements of the heads of their country. I mean, a perfect example of this is the Mexican president, López Obrador, who early on, despite his public health people warning him against this, it was encouraging the kissing of babies and the downplaying of need for masks. That sound familiar to some of you out there? It certainly is familiar in the United States. He even flaunted good luck charms as his defense against the virus, and cautioned not to respond to the threat for or the need for health resources such as respirators or protective equipment for first-line health workers. And that will be a particular connection to the public health issues involved in low-income or moderate-income countries like Mexico. And at the same time that was happening, one of his main political proteges, Claudia Sheinbaum, who is an incredibly competent mayor of Mexico City, and Mexico City has had a history of incredibly incompetent mayors who have not cared about the people, but she is totally unlike that. She recognized the issue, and she has a science background, and even though she would not publicly counter the López Obrador line about this was not a really big problem, you should go out and do your jobs. In the past week, almost 9,000 people died in Mexico. And this is likely an undercount, especially for the older population, who have a tremendous fear of public hospitals and would rather die at home. This is one of the causes of getting any really accurate public health ideas about what's going on in countries like Mexico. Next slide, please. Can you switch to the next slide? Yeah. And as I said before, the estimated infection rate is 30%. And one of the problems that emerged early in the United States is epitomized in the slide on the left, where the relatively unregulated long-term care environments were overwhelmed with coronavirus cases and did not have the resources to deal with this. And so here you have one of the early cases of a woman who was brought from one of those care centers into hospitals. And very, very soon, especially in Mexico City, and both these images, both the cemetery, which is overflowing, and the woman who's being brought from a elder care center into a public hospital, the mayor of the city actually quickly responded, even though there was a tiny amount of ICU beds and respirators. She went out and spent a significant part of the city budget and purchased ventilators from China and the United States, especially, and increased the ICU beds about 5 or 6 times. But without a coordinated federal help, this still is causing a huge issue in places like Mexico City, a city which I know and love very, very dearly. Next slide. Can you do the next slide? Hello. There you go.
It takes a while, a bit, sorry.
Okay, no, thank you very much. This gives you an idea. The green line at the bottom is the diagnostic tests done in Mexico. And this compares it with Argentina, Brazil, which is kind of in the middle. And you see, not only is the Mexican data for diagnostic tests the lowest, even in August and September, as the numbers just accelerate, but it is almost flatline low. So there is no systematic nationwide effort to deal with this. And when you're talking about public health in a significantly large country like Mexico, this is really critical in terms of dealing with a pandemic such as this. Now, one of the ironies of the initial ideas in the public's mind in Mexico and in politicians' minds that coronavirus was a virus of the very, very rich who could afford to take their whole family skiing in Vail, Colorado. With the data we have now, something like 70% of all of the cases are impacting people with only a public school education. And so this reflects the impact on the poorer population in the city. And as was mentioned before, this is impacting people, especially in early stages of late life in the 60s. And that's significant because the spike, when you look at the graphs of the data we have right now, the numbers peak at about 65 to 70. And in terms of thinking about my 4+ decades in Mexico City, one of the things that you note, and this happens in Peru, it happens in Brazil, is that a huge component of especially the urban economy involves informal marketing. And you have people in the 50s, 60s, and sometimes early 70s who are surviving by small businesses out in the streets of the city. And this is certainly the case throughout the urban areas of Mexico. So you have a situation, a dual impact in terms of public health uh, of, um, of a low percentage of people who are in care environments. And I'll speak about care environments in a little while. And so they are often living with their spouse, or sometimes alone, but often near their children. And people in their mid 60s are often surviving by going out and working in the city. And if they don't, they're worried about starving. And huge number of households that include older individuals have younger adults who are working, sometimes in the healthcare infrastructure. And this is the dual problem. You have the older people who are working out to survive in the city. You have, say, a married or adult daughter who's working in a public hospital. And one of the public health issues that has impacted Mexico and other places, including the United States, is the lack of protective gear. And this is particularly acute both in public hospitals and in elder care centers in Mexico. So you have these two factors, both the older individuals who are in their 60s who are working out in the community to prevent themselves from starving, and younger members of the family working in health environments that can bring back infections into the household. And one of the things I've seen in working in public health and with public health hospitals in a number of countries, such as the former Yugoslavia, where I worked in the 80s, 1980s, training public health physicians, is that small kinds of things can make a huge difference. So one of the things that happened in the former Yugoslavia was that the gerontologists there, who were really instrumental in this, for years had argued that all older individuals should have a small income coming in on a regular basis. They finally got that, I believe, in the 1970s, and this was a huge help in stabilizing extended family environments. And this might be something for a country like Mexico to consider, even on a temporary basis, to prevent the absolute explosion that is happening right now in places like Mexico City and the larger cities in the north. Now, one of the things to note about the public health infrastructure for older adults in Mexico City is that a relatively small number live in special care environments, estimated about 0.5%, less than 1%. But interestingly enough, even before the COVID-19 disaster, there was a huge divide between the relatively high-end elder care environments that were developed over the last 20 years, often in resort areas, and they especially were trying to attract elder US retirees. And some of these are really nice, almost hotel resort kind of places that are attractive to US elder retirees, and I guess to some British retirees as well, who have flocked to resort areas in retirement. This is in contrast to the regular Mexican elder care environments, many of whom are totally unregulated, and where there is very, very inadequate training of the personnel, and where, like, I got to say, like in the U.S., there's been some extraordinary bursts of death in long-term care environments. In Mexico, this has been particularly bad. One of the recent reports from northern Mexico, from the state health secretary in one of the more northern states, talked about deplorable hygiene, hypercrowding in quarters, beds very, very close together, dirty bathrooms, and and the problem is there is virtually no regulation of a huge number of these environments, and relatively poor training of the personnel. And even more so from a public health standpoint, there seems to be absolutely no consequence for personnel or for those environments when people are impaired or killed by the bad action of the workers or the environments. In terms of gerontology, one of the things that has been one of my mantras for many years is that often, and I've been known to do this as well, is to focus too much on the national data or even regional data of a country and not understand how the lives of older people are connected to their social and infrastructure environments. And this is frankly what anthropologists do. As an anthropologist, I've worked on this, as I said, in former Yugoslavia, helping train public health doctors, and also actually in Islington, in London, working with the council on environments for people who are going to be released from psychiatric hospitals back into various communities there. And my emphasis has been on learning the process by which people live out their lives and how they either stay healthy or get sick and impaired. And to me, as an anthropologist, this has to be one of the vital things that gerontologists involve themselves in. And I know some of the people here on the panel understand this very, very well. So I will leave it there. And if there's any questions, I'll be glad to answer them. I was told that about 15 minutes, probably went over that. I don't know. So thank you very much.
Okay, well, thank you so much, Jay. You went slightly over, but I wasn't going to interrupt you because it was absolutely fascinating, the range of issues that you've addressed in that presentation, and also the way in which there's that resonance between what's happening in Mexico, but also what we know is happening in other parts of the world. And we'll pick that up in the discussion. So we're now going to turn to our second speaker, who is Dr. Yeda Aparecida de Oliveira Duarte, and I hope that I've got that almost right. She works in the School of Nursing in the Faculty of Public Health at the University of Sao Paulo in Brazil. And Yeda belongs to what I would regard as a growing cohort of interdisciplinary researchers on aging, whose work really spans the fields of biological, medical, and health gerontology, and probably some other things besides. She's been working on comparative studies of the oldest old in Brazil and in the UK, but has mainly worked in the context of Brazil on the multi-center survey on health, well-being, and aging, the SABE study. which is a study that's spread across 7 countries in Latin America and the Caribbean. And this project, the SAY project, focuses on the health and living conditions of older adults aged 60 and over. And the Brazilian component has become a cohort study, a longitudinal study with, I think, up to 3 waves of data collection, which has allowed IEDA to publish on a really wide range of topics linked to the epidemiology of aging, health inequalities in later life, health-related quality of life, elder abuse and neglect, and so much more besides. So I'm really pleased to be able to introduce IEDA, whose paper for this webinar is on the topic of gerontology and COVID-19, Brazilian perspectives. I can think of no better presenter on this particular topic. And from the perspective of something we learned just before we came on air is also that IEDA has her own personal experience of COVID, which, you know, I hope that you have the energy to take us through the presentation, but we are also very tolerant of the circumstances in which you find yourself, IEDA.
Thank you. Thank you very much. Thank you for a gentle presentation. Sorry for my English is not so good, but I try to do my best. And I'd like to share with you a very good initiative in Brazil in the COVID pandemic situation. The purpose, next, Lucas, please. The purpose of this conversation is to discuss how gerontologists may be able to contribute to addressing the pandemic COVID-19. And for this, I choose one of the important activities developed in Brazil by civil society to present it to you today. Brazil has now about 30 million older people. In Brazil, older people is people who have 60 years and more, different in the other countries. And next, Lucas. And Brazil is a large country with many inequities. You can see an example in this map. This map shows you the proportion of people below the poverty line by a federation unit. It was made in 2017, when 26.5% of the population was below the poverty line in Brazil. We think that after the pandemic, this percentage is expected to increase, and we are worrisome about it. Next, please, Lucas. The first things we heard about the coronavirus. The new coronavirus in 2019 was a new strain that had not previously been identified in humans. It appeared in December 2019, like a pneumonia of unknown etiology detected in the city of Wuhan in China. Quickly spread across the Europe, reaching the American continent and Brazil between February and March 2020. Next, Lucas, please. News about infection and death in other countries lead to the organization of different health services across the country, across the Brazil. Next. Throughout the country, a lot of information was disseminated, and we working a lot in different contexts about transmission, care, next please, contagion period, incubation time, next please, and especially in care and protection for all the population and especially for older people. Next please. But all the time we heard news about the disease and death in the world. And next, please, especially about the death of the elderly. Because of this, because we heard a lot about the high mortality of elderly people, especially in Europe, a group of gerontologists with me, I am one of these, wrote a document for health authorities in Brazil with the aim of giving visibility to the most vulnerable elderly people, those who resided in nursing homes. I would like to say you that in Brazil, people who lives in nursing homes is less than 1% of the population, of the elder population in Brazil. It's not a cultural thing that we do normally in Brazil. But these people, we heard in all the world about death in this kind of place. Then we did this document, and this document spread quickly until reached at the authorities. After this, they go to the media, they spread in all the country, and we can did a meeting with the federal authorities. After this, we have initiated a great national movement of specialists in gerontology, working together to minimize the impact of the pandemic in nursing homes. Next, Lucas, please. This initiative is coordinated until now by Dr. Carla Giacomin. Dr. Carla is a physician, is a geriatricist, but is gerontologist too. And this initiative was and is very, very, very important because it can put together to work all gerontologists in all the country, in different parts of the country, to make the national front to strengthen the long-term care institutions for the elderly. This is the principal document. And after this, next, Lucas, we did a lot of documents that for help this kind of places, the nursing home places, to help people and to try to control the pandemic situations in these places. This was a well-organized civil society initiative that resulted in changes in laws and the release of funds on all an urgent basis. And the result of this is helping the most deprived homes in the organizing care for the elderly across the country. Next, please. Many other things have been and are being done by the country. Research, organized work, isolation of the population since March 2020. We have campaign hospitals and the other things spread of all the country. But this initiative was made by civil society, and the results of this is very, very, very good. We can heard about, sorry, but it is in Portuguese because it's yesterday in the news of yesterday, and I'd like to show you the situation, the actual situation in Brazil. This is the picture of the situation in Brazil today. No, and the next, please. You can see the number of cases in millions in Brazil and the numbers of deaths. 70% of these deaths is older people. Then we work together in the nursing homes, but because we are very worrisome with that people that live there. Next, please. Due to the economic crisis caused by the pandemic, and because 2020 is an election year in Brazil, we are now gradually relaxing social distance. And we are worrisome with the situation because only the future will show us the consequence of these actions. I know that news in outside of Brazil, I don't know exactly what you heard about it, but in Brazil now we have some policies problems, and we don't have a health minister in this picture of pandemic situation. And this is a very big problem now. But I think the initiative, the different initiatives in different local governments and the work with the civil society could control. I don't know if I can control the problem of the pandemic in Brazil until now. But we are the gerontologists, the health professionals are very worrisome with the future. Thank you. I would like to discuss with you if you would like to.
Thanks so much, Yeda. That was really absolutely fascinating. And certainly in the United Kingdom, you know, we are very much aware of what's going on in Brazil. There's a lot of reporting about what's been happening in Brazil, rather less so in Mexico, I think. And that's, you know, it's quite interesting to even think about why there is this difference. So what we're going to do now is we're going to have a discussion where we can ask questions of Jay and of Yeda based on their own experiences, thinking about what role gerontology can play in relation to the questions that have been raised about aging and COVID in middle-income countries. And one of the because I'm chairing this session, I get to start off and ask a question that, you know, has struck me about the UK situation. And I think there are parallels with what we've all picked up from Jay's presentation and Yeda's presentation about Mexico and Brazil. And that's something that it goes into the political domain very quickly. So there's an argument that the COVID crisis in the UK, at least, has been treated more as a political crisis than as a health crisis by people in positions of authority, by government. And that it's the managing the political crisis has shaped the you know, the entire public response to COVID, which is partly why you know, we haven't in the UK done as well as other countries in containing the virus, why we've had so many more deaths than other European countries. And if we treated this as a health crisis, we would have done things rather differently in terms of listening to advice, not just of gerontologists, but of people, of epidemiologists, virologists, and other researchers. So I'm just wondering if we could maybe start off at the level of thinking, well, you know, would the response have been better in Mexico and in Brazil if COVID had been treated more as a health crisis than as a political crisis? Would anybody be able to is, you know, is that even a question? Would, you know, a legitimate question? Jay or Yeda, you can just come in there with, if you turn your microphones on.
I don't know. I think we have the two, the political and the health crisis. But I think we need to work together. We have this problem in Brazil now. We don't work together. The health authorities try to work in different federal units. And we don't have a federal way. Is not the same way, and it's not good. It's not good for the population, because the population don't know what they need to do. Sometimes they heard about one thing, the authorities say, take this medicine, take these other things. You don't need to use masks, and things like this. In the middle of the pandemic situation, we think that is terrible for the control of the pandemic situation and the epidemic situation in Brazil, and I think we need to work together. But it is very difficult now with the actual government in Brazil. Yeah. I don't know if I can answer your question.
I think it's interesting, because it came to mind when you were talking about the fact that there's an election happening in Brazil, and if we look across the United States as well, that the way in which the pandemic is being handled there is heavily shaped by political considerations linked to the upcoming election. I'm wondering, Jay, whether that, you know, with your obviously.
I started to say something, I was muted. Yeah, it's rather ironic. In the US, there is an incredible infrastructure related to gerontology that goes from the federal level, National Institute on Aging, to the state area agencies on aging, and an incredibly successful and powerful public health infrastructure, which for the last 20 years, if not longer, has really recognized the importance of focusing on the life course and aging in terms of health issues. And even there, that whole infrastructure has been literally subverted by the political interests of the election and the political party. What's scary to me is how much both the presidents, the leaders of Mexico and Brazil have almost mimicked or been almost ventriloquized by the Trump ideas about not panicking population. This was actually said by the Mexican president recently, as if he had had a pre-publication manuscript of the Woodward book with Trump saying, well, as a good leader, I didn't want to panic the population, while he privately would tell Woodward that he knew, as well as anybody, how bad this thing was going to be. So you can imagine how, in a country like Brazil or Mexico, and I think Brazil, in terms of thinking of gerontology and the gerontological network, is probably at least a decade ahead of Mexico. And one of the things I wanted to frame this by is that countries like Mexico and many of the international nations that we're trying to think about, for years basically tried their best to ignore the public health issues of late life, as if either it didn't exist or whatever problems the elderly had will be taken care of by our strong family system. This was the case in China before, and it's interesting that it'd be a whole discussion of public health and aging in places like China, where when Thomas had made the introduction of my cultural context of aging book, and I think in the second edition, Charlotte Eichels is one of the premier scholars in aging in China. When she published an article about China, at that point, probably in the early 90s, long-term care environments and nursing homes were forbidden to be built in most of the cities in China by state law. And 6 months after the book was published, the crisis got so bad in terms of support of the elderly that this law was totally reversed. And today the situation in China is extraordinary in terms of recognizing the need to build environments to care for Chinese elders outside the family. And places like Mexico and Brazil really haven't gotten to that point, that basically assuming that families can take care of it. One of the things I would like to throw in here, which is certainly important in terms of this kind of crisis, is the issue of resilience. And gerontologists have been involved with this in cases like what happened in Europe during the heat waves in the 90s, especially in France, where so many thousands of elders died in August when their younger family members were out of the country and vacationing. And this issue of resilience, I think this should be one of the most important discussions of how elders themselves can be part of building resilience when we assume that crises like this, from climate, from earthquakes, certainly in Mexico, that's been a big issue, will hit. How can older citizens be part of building resilience to survive such events? I've talked too much. People can ask questions.
Well, I was just going to say that we do have some questions that have come in, and it would be churlish not to not to pose those questions of our speakers, and they're spread nicely across the speakers. So there's a question here from Malakapur Shankadas, who's wondering, Jay, what kind of role gerontologists as a community play in Mexico, and whether they've been able to raise awareness of some of the challenges or the weaknesses of government policy responses around COVID.
There has, since 2008, there's a National Institute of Geriatrics. There has developed through Mexican gerontology societies, and Peter knows the people involved as well, if not better than I do, but they recognize that they're really swimming and talking against the tide of sentiment, which is still strongly telling gerontologists that the family system should be the main bulwark for taking care of the elderly. Nevertheless, I would predict that in the next decade that the emerging gerontologists in Mexico will have a much bigger voice in public policy as the failures of the political system to deal with the current crisis become more and more evident. But they have organizations. In terms of practical things, one of the things that the politicians have funded are senior clubs. So even in this small indigenous community, when I came back in 2010, I was surprised to find that they had just established a senior club, and it was organized by the current political party that was in power in the municipal government. And they had monthly meetings, and they gave away food to the poorest elderly in the community. And in a way, it was very, very positive in answering the very, very good question, in that while I was there and did video of the meeting so I can present it to the community, there were health activists from the local major city who were talking about the impact of diabetes, especially on eyesight, and giving free eye exams to the 50 people who were there, who were the senior members of the clubs. Ironically, and this gets back to Thomas's discussion about politics, when that political party lost the next election, the financial support for the clubs in the region was basically cut in half. So it indicates the lack of infrastructure that can be sustained. And I have a feeling in places like Brazil and throughout Latin America, this is unfortunately often the case.
Okay, that's really good. I was just wondering, Yeda, whether you wanted to come in there. That, you know, it's really good to hear about the National Front project, which has its focus on long-term care institutions.
Yes.
I'm wondering about the wider gerontology community, whether they've been able to, you know, to gather as a voice that can challenge some of what's been happening around aging, and, you know, with the high death rates of older people, the excessive risks faced by older people in terms of of COVID, whether the gerontology community has been able to respond to the crisis.
Yes, this initiative occurred in the first time. If I can see, it's not a good thing to say, but the crisis to do a good thing, to show to the society people that we never saw before, people that lives in nursing homes, people lives alone, older people living in nursing home, older people living alone, and the older people, homeless older people. We never saw these people. Then now the crisis, with the crisis, we can saw all these people. And this initiative, in the beginning, work with all gerontologists in the country. It's a national movement. And the result is work with the police authorities. We have funds, we have laws, we change the laws, and we receive the funds to the nursing homes, and that never received before. Then I think, and I hope, I and the others know, because I work in this initiative too. We think that we would like to this initiative begin the construction to the policy of long-term care. We don't have this in Brazil. We need to do this, and we think this thing is the beginning of this.
Okay. As well, we're talking then about long-term care, and I'll pick up on a question that's come in about people who don't live in care settings. In the UK, at least, there's been a big discussion about family visits to long-term care settings. So many long-term care settings have effectively shut down and stopped family members, friends from visiting. I'm wondering, is that also the case in Brazil? And if so, has there been any focus on the rights of residents, the rights of family to keep an eye on, to visit family members in care settings?
We work with all families that it's a kind of protection to people who live in nursing homes, that visitors is forbidden in this moment, and they can understand. And we work with the other people inside the nursing homes. Not a kind of a bad situation, but a kind of protection situation. We use a kind of phones, iPads, TVs, other things to put older people in communication with the family. In other situations, when this kind of thing is not possible, they put family in one side of the street and the older people in the other side of the street, and you can see one another, but you don't touch. No, they have a social distance, but to relax, to other people relax. Sometimes they can't understand the situations, and the dispositive like smartphone and the other things don't help in this situation. Then we have a lot of different situations that approach family and the people, but visit until now is forbidden.
Okay, thanks for clarifying that. So the other question that has come through is about, are there any practical measures that have been put in place for older adults who don't live in nursing homes? So in terms of people who may need help with their shopping or with domestic, other domestic tasks, people who may need care at home but aren't living in care homes. You know, has the government managed, the social services, healthcare services managed to support people who, you know, may not have family members living in the area around them who can lend a hand?
It was another initiative we have here, and it was successful too. The name of this, we have more than one, but one of them is WhatsApp Angel. Then you say a message for all people that you know in WhatsApp, that you know that live alone. And you said, and you asked to them, you need something, I can help you. If you need something to buy or to do the other things, you stay in home and I buy for you. This is spreading in very big cities, and people put in the way, in the entrance, in the way, in the buildings, and the other things, the names of the people that can help other people that lives there. Then it's a solidarity movement in Brazil, and it was very, very good. It's social initiative too, but the authorities didn't do nothing. But we have a public program only in São Paulo city, but São Paulo city is a very big city, that they put caregivers to help these people that lives alone, to make the shopping, to take medicine and the other things that they need.
Okay. Thank you. That's really helpful. And that answer sort of leads us into a third question that's come in from Patricia Conboy, who works with HelpAge International. And her question focuses on the shielding of older people. So in many countries, governments have advised older people to stay home, to avoid going out, as the public health measure to minimize the risk of older people becoming infected with COVID. And the question that Patricia's asking here is, what would your advice be to governments who take that approach? You know, would you say that this is from a gerontological perspective, is this good advice, or does it go so too far in restricting the rights of older people to live, you know, a normal life, whatever a normal life actually is.
I think when I work with older people, I have, as you said, longitudinal study. I'm following these people for 20 years. Then when I talk to them, I normally explain that it's not, we don't violate your right. We try to protect you. We like you. We would like that you alive tomorrow. Then this kind of thing is we use this kind of things for some time, not eternity. And they need to understand that it's a kind of protection. But if they don't like to do this, it's a right of them. But they choose what they want, protection for your health or not. They decided. It's autonomy of them.
And is that advice aimed at people above a certain age? Is there a chronological, you know, barrier? Because in some countries, people over 65 or over 70 have been asked to stay at home and to withdraw from society. Is there a discussion about the chronological age in a country like Brazil?
Here is 60 and over.
Okay.
Because you have a lot of inequities. And 60 in São Paulo is one thing, 60 in Northwest is another thing. Then until now, older people in Brazil is 60 and over.
Okay. Well, that's quite interesting. And also then it takes back to a question that I had for Jay, really, which is about labour market participation, that you mentioned the challenges of, you know, older family members obliged to work, younger family members also in the labour market. You know, we're being encouraged now through policy to work longer. And what we've seen in a country like the UK, of course, is that many older people are voting with their feet and are leaving the labour market for a whole host of different reasons, setting back a trend to longer working lives. I'm just wondering, you know, where that fits in within the sort of the context of Mexico, perhaps, is if you're inviting older people to shield, but also saying go to work or continue to work, there's an inevitable contradiction there in sort of public messaging.
Yeah. Well, as I'm sure there is the case in other countries like Brazil, there's a big difference between rural communities and towns and urban areas. In the village I've been working with, and in my household there, where my godchildren are, there's in their house compound, there's 18 people living there. A bunch of kids, a great grandmother, a grandmother who just was the widow of, she's my comadre. And the model there is for the older citizens to take care of the domestic economy and running of the household, and for the people who probably under 60 to be out and about bringing money into the community. In urban areas, it's fairly different, even though the ideology is the same, especially for older women who have the dual responsibility of managing the household. But in a huge percentage of urban poor families, they have no option other than supplementing a very, very limited money coming in from the government for old people over 60 to go out and to supplement the budget. And the dilemma happens in terms of the infrastructure of aging when they become somewhat disabled. There's really no system of household medical support for people. So they, in the urban areas especially, they have to be out there and work as well as maintain the household, especially when there's young children there and their younger adult children are out and about, bringing in money into the household. I have not heard anything back to your original discussion of trying to encourage or mandate um, older citizens to stay in their homes. Ironically, in terms of Mexico City, where the epidemic is the worst, they have the studies by gerontologists have indicated that people, when they leave their house, are more likely to wear a mask than even in the United States. Yet they are forced to be in situations where they will rapidly take off their masks if they are selling stuff and shouting in a public square to buy my tortillas or buy my roasted corn or buy these handicrafts that I have made in very, very crowded market situations. Um, so there has not, in Mexico, as far as I know, been a push to keep the elderly in per se.
I think that's really interesting. One of the valuable lessons to be learned from looking at experiences in different middle income countries is that there are such contrasts between Brazil and Mexico in terms of, say, the availability of a social pension, which could make all the difference, which is what you were saying in your presentation, was about whether even to introduce something along those lines on a temporary basis until the pandemic comes to an end could have really positive
Right. I
impact.
would say there is some social pension. It
Right.
is so tiny that with the increasing costs of running households and educating children and grandchildren, it's almost irrelevant. So it would need, as has happened in the United States, where they had an initial burst of support for people who became unemployed, that that no one anticipated that the pandemic would go so long, but they obviously need to continue that. And people have speculated whether or not the current crisis, which has exposed the vast impact, differential impact on the modestly poor and the wealthy, whether this would have a longer term impact on public policy. I haven't seen that yet. There would have to be a change in the political party in office to see that happen.
Yeah, I think the longer the pandemic goes on in different countries, the more evident it is the unequal way in which the pandemic is affecting different groups within the populations, whether that's based on socioeconomic status or urban and rural, or different minority ethnic groups in particular. And I know, I'm not sure how that's been played out in both Mexico and Brazil, where minority populations, migrants, whether people of sort of Japanese ethnicity or of Chinese ethnicity, whether these groups are more affected or less affected by COVID than other populations. In the United Kingdom, there's a strong focus on Black and Asian groups as being most adversely affected by the pandemic in terms of risk of ill health and of premature mortality. I'm not sure whether the evidence points to those similar risks in Mexico or in Brazil.
Well, I would comment that before, on a positive sense, For the past 3 years, say before the pandemic hit, there were movements of indigenous communities, such as the one that I've lived in, but even more so in places like Chiapas or the Mayan region, which overlaps with places like Guatemala, where governmental authorities have recognized the absolute impoverishment of the poorest poor, of the elderly, and have sought to develop local support for that. And I saw that distinctly in the community I've lived in for 50 years, where I never saw that before. But the last few years, before the epidemic hit, there was recognition that the poorest poor up in the mountains above the central part of the community had to be better supported. And this came sort of through local municipal people who had the expertise and would work with people in the community itself, the leaders of the community, to bring improve housing and at least better food and even clothing for the cold winters at 9,000, 10,000 feet of the people who are living there, which can be a real problem.
Okay. We're rapidly nearing the end of our allotted time. I didn't know whether, Yeda, you wanted to come in at all on that point or any other point that you would like to make?
Yes, I'd like to say that in Brazil, the most part of the older people, because they have retirement or pensions, they contribute a lot with the family income. And recently, we read a paper that described that if an elderly person die, a family will enter in a poverty line. It was very good paper by Ana Camarão. She's an economist in Brazil, and she's a gerontologist too. She analyzed this. When older people, most part of the older people that dying with the COVID and pandemic conditions, part of these families are cross the poverty line in Brazil. They put the other side. You can saw the older people with the other eyes. It's a good thing to think in the future.
Okay, thanks so much for that comment. I'm going to just finish my part by thanking both Jay Sokolowski and Yeda Duarte for absolutely fascinating presentations, and also for responding so well to the questions. And I'm going to pass now back to Peter, and possibly somebody else who's going to come online. But thanks so much for the invitation.
Thank you. That was great. Great moderating.
Hi, just a couple of things to wrap up. Firstly, by the way, just following on from what Yeda was saying about that very interesting paper about the economic effects of coronavirus on families when older people die. The main author of that, Ana Amelia Camarano, I'm in touch with her, and there is going to be an English language version of that paper being published in a couple of weeks. And she's agreed to share that on our website. So that will be something we will be sharing. I've seen the version in Portuguese, and I agree with Yeda. It's very important research, and hopefully it will help frame some of the thinking about coronavirus and some of the ageist attitudes towards the disposability of older people, which I think are extremely concerning. What I'm going to do now is quickly go back to Penny Verasanso, who is one of the main organizers of the special interest group on aging in Asia, Africa, and Latin America, and they're co-hosting this session with the Global Platform. And I think it would be very helpful if Penny wanted to sort of think out loud a little bit about what this particular bunch of gerontologists might be able to do in terms of the global context of the pandemic. So over to you, Penny.
Thank you very much. This is a really interesting webinar, and it sort of epitomizes what we're trying to do with the special interest group on aging in Africa, Asia, and Latin America. And that is to provide a space where we can talk about the very specific situation of these global South countries, of people in the global South and the way they live, bringing up this whole thing that Jay said about, not working with data, and also not working with ideas generated in Europe about older people, which is kind of ageist to just assume it all applies elsewhere. And so one of the things that was very interesting today was we were talking about transmission, routes of transmission. But what would also be interesting would be to know why, routes, what inhibits transmission, because we haven't really talked about that. And that would be something that as a group of people, we could be involved in to see how that works. And I also think it's very important because taking perspectives from other parts of the world can feed back into what's happening in Europe, instead of it always being one way or the other from Europe to the rest. And the SIG is really there to provide a platform, draw people together, to provide a space to put materials on the platform so that people who don't necessarily have access to journals and so on can have that. And that we can start to look at solutions as Yeda provided and so on. So it's hard to know what we can do in terms of COVID itself at the moment. As you say, gerontologists don't have a space, but if we don't have a space to even talk to ourselves and learn from each other, then that's going to be very difficult in terms of what happens in the global South. So that's what we're doing. We welcome everybody to participate, and it's free to join. And here, the BSG globalsouth@gmail.com. Get in touch and we'll put you on the Microsoft Teams site. Thank you.
Thank you very much, Penny. And I agree, talking to ourselves matters. I think also talking to other academics is also very important, breaking out of our comfort zone. In a few months, there will be the 16th World Congress on Public Health. And it's notable how little representation gerontologists, or more specifically geriatricians, have within that event. And I think that's quite representative of what's going on. Over the chats, I shared a really nice webpage that the British Society of Gerontology, of which Thomas is president, has put up about coronavirus. So again, that's more evidence about what gerontologists can do. Also over the chat, several people expressed interest in a webinar possibly focused on India or South Asia more generally. So I'll be in touch with you about that. We're about to relaunch our website. It's going to be considerably revamped. We will still be publishing blogs as often as we can. So if you have anything of interest that you think you would be open to writing a short informal blog about, it would be great, because we really need to keep content coming into the website so that people find it useful. Also, we will have a focus on age disaggregated data on coronavirus in low and middle income countries. And if you come across sources, we will list sources of data and we will provide updates of data every month. But if you are from a country that we haven't listed a data source from, for example, Yeda was referring to data from Brazil, it would be fantastic if you could bring that to our attention. We have our next webinar, I think, is going to be in October, and it will be jointly with a network called LTC COVID, which many of you, I'm sure, know about, and it will be focusing on long-term care outside of care homes. So coronavirus and long-term care in community settings in low and middle income countries. And of course, there are many issues we can explore there. If you have a suggestion about a webinar, please see our online form and send us a proposal, and we will try and host that webinar for you. Next slide, please. So that's it. thank you so much to Thomas, who's done a brilliant job of chairing the session, to Jay and to Yeda, who I think have given excellent talks. Thank you to Penny and the Special Interest Group for co-hosting this and co-publicising this event. And of course, thank you to the people who are working behind the scenes to make sure that these events operate very, very smoothly and seamlessly. So thank you all. Do keep an eye on our website and do keep an eye open for our next webinar. Goodbye.